PHAR 110. This is the start of Unit 2 in the textbook, which takes the theory from chapters 1 through 5 and introduces the student to techniques and competencies for preparing sterile compounds. The laboratory component will be hands-on practice of the theory in chapters 6 through 14. Please be sure you have read Unit 2 Compounding Sterile Preparation pages 157 through 163 for some background. On pages 162 and 163, you will find an outline of sterile compounding procedures for the anteroom and the clean room. Chapter 6, Aseptic Garbing, Hand Washing, and Gloving. The learning objectives for this chapter are to explain best practice as it applies to sterile compounding, compare and contrast early concepts of germ transmission and current procedures for aseptic garbing, hand washing, and gloving, describe the procedures for aseptic garbing, hand washing, and gloving according to USP Chapter 797 guidelines, and evaluate procedures utilized in maintaining asepsis during aseptic garbing, hand washing, and gloving, including identifying breaks in procedure and corrective actions. Aseptic technique begins before the act of preparing the sterile compound. Proper garbing, hand washing, and gloving help to avoid introducing pathogens to the sterile products. Sanitation, cleanliness, and infection control are more of a modern thought process. Many concepts were introduced in the 1800s have continued to evolve to the standards we observe today. Current sterile attire reduces incidences of nosocomial, which is hospital-acquired, hospital-borne, or healthcare-associated infections. Before beginning the sterile compounding process, IV technicians must assess their own physical appearance for any violations. You should not be wearing any cosmetics, hairspray, perfume, artificial nails, or nail polish. All jewelry should be removed, including body piercings that are not covered by a gown and mask. Fingernails should be kept closely trimmed to make it easier to remove the bacteria from under the nails, approximately 2 millimeters in length. You should have no weeping sores, sunburn, rash, or respiratory infections. Sterile compounding personnel begin the process of donning personal protective equipment, or PPE. This is to minimize the risk of contamination of the sterile compounding area and the compounded sterile preparation. In addition to donning PPE, IV technicians also perform an aseptic hand washing, a hand washing procedure that is much more stringent than a basic hand washing. The PPE that a technician will wear prior to the hand washing includes shoe covers, hair cover, and a face mask. May also include a beer cover. So let's review these essential supplies. The hair cover. The option for hair covers include disposable caps as well as washable caps in surgical or bouffant style. Generally, we use the bouffant cap, which is pictured here. Some people with lots of hair may need more than one cap to capture all the hair. Now, in following best practice, the garbing sequence is to first sanitize your hands with sterile foamed IPA, 70% isopropyl alcohol, then don the hair cover. The next step would to be sanitize the hands again, then don the mask. The face mask is generally worn. It's either going to be a tie or, as you see in this photo, a ear loop. Now, if the technician has a beard, they would put their beard cover on prior to putting on their face mask, as seen in the picture on the bottom. Now, the picture of the face mask here to me looks upside down because the way the pleats are on this mask. The pleat should actually be open to the downside. And how you can also tell is at the top side of the mask, there's a pliable metal strip that can be pinched to fit snugly over your nose. Next, you will again sanitize your hands and then don your shoe covers. Technicians should be wearing closed-toed shoes because of the potential for injury by a needle or broken glass. Shoes should be clean, well-fitting, and of the walking or running shoe or workplace safety type shoe. The disposable shoe covers are put on over the shoe to keep the dirt and other substances from contaminating the clean room floor. Of course, we know prior to entering the clean room, you'll actually step on the sticky mat to remove any kind of static materials that may have been picked up by the shoe covers. The hand washing procedure takes place after the donning of the first level of PPE. The IV technician will wash their forearms and hands using an appropriate antimicrobial agent following a specific sequence. It's important to pay special attention to areas that harbor multiple microorganisms, like under the fingernails and the creases of the skin, like around the cuticle and around the wrist. Learning this process is critical because the most common source of contamination in the preparation of parenteral products is touch contamination. The following situations would require the completion of an aseptic hand washing. At the beginning of a shift when first entering the sterile compounding area, or when re-entering the sterile compounding area from another area within the pharmacy, or after eating, using the restroom, sneezing or coughing, or after having a major contamination such as a needle stick or a drug spill with a volume greater than 5 milliliters. Also, after the hands touch any item that is obviously contaminated, like the floor, the waste receptacle or a sharps container, or any visibly soiled item. As I stated previously, we use a foamed 70% isopropyl alcohol to sanitize our hands prior to donning our PPE. These can also be used in between. If you touch your pen or your glasses, you don't necessarily have to do a full hand wash. You can sanitize your gloves. You can also use alcohol. Now, as far as the hand cleanser, when you're washing your hands, there are specific ones that are identified for use. Chlorhexaphenol is an effective common cleansing agent that's appropriate for aseptic hand washing and is actually often on those sponges that we use. Chlorhexidine gluconate is also a common and appropriate cleansing agent for aseptic hand washing. The isopropyl rinses, gels, or foams can be done prior to donning the PPE and between aseptic hand washing procedures when there's minor hand contamination, as I stated previously, like when you're handling a label or a medication order or adjusting your eyeglasses. Iodophores and triclosan are not appropriate for sterile hand washing. Iodophores, such as povidone iodine, it has an effective antimicrobial property, but it will irritate the skin. Triclosan is often in household soaps, except really today it's being phased out. It may be appropriate for a general hand wash, but not an aseptic hand wash. In certain situations, sterile compounding personnel may cleanse their hands or gloves with the foaming IPA or with alcohol spray. And that is upon entering the anteroom prior to donning the PPE, after using a calculator or a pen, after spilling a few drops of liquid on a gloved hand, less than 5 milliliters, or when there's a potential for minor hand contamination, such as after adjusting your eyeglasses or handling labels. After hand washing has been completed, the technician will put on the last two items of PPE, a sterile gown and a pair of sterile gloves. In some settings, sterile gloves are not used, and the non-sterile gloves will need to be sanitized prior to entering the IV room or prior to preparing any sterile compounds, and that would be achieved using 70% isopropyl alcohol. Now, part of the reason that we wear the gown and the gloves is that a human sheds more than 1 million skin cells every hour, and these cells can harbor organisms that could contaminate a sterile product, and also just be a contaminant or itself. IV technicians who have aseptically cleansed their hands will place their hands inside the sterile gloves, and that helps to compensate for two potentials. One, the ripping or puncturing of a glove by a needle or glass shard, and two, the growth of microorganisms on poorly cleaned hands that are then in a warm, moist environment, which makes it easy for things to grow. And then there's micropores, which potentially could cause something to absorb through the glove, but could also go out of the glove through these micropores and contaminate the area. The appropriate attire includes scrubs. Technicians want to layer their attire so that they're appropriate for the warmth level, and that they're comfortable and practical. It's important that the technician has the ability to fully move, so too many layers can be rather constrictive. Also, once you start putting on the gown and you're working, you may find yourself getting warm, although the clean room is generally kept to a cooler temperature. It's very important to wear clean scrub uniforms, and in some cases, your scrubs, you have to put them on once you get to work. For preparing sterile compounds, you must also wear either a sterile lint-free disposable gown or a gown that has been freshly laundered and sanitized by the hospital's laundry department. The gown should completely cover the front of the technician and have a secure neck closure with a tie in the back to fit snugly around the wrists. So the fitting snugly around the wrists generally will either be an elastic band or even perhaps a cuff, a knit cuff. The closure could be a necktie, or it could be a type of gown that fits over the head and fits over the shoulders. The gloves should be sterile. And again, if your hospital doesn't do sterile gloves, then you would use non-sterile and sanitize them. But the gloves need to be powder-free. Generally, synthetic non-latex gloves are available for what's used mostly because of latex allergies. If you have a latex sensitivity, you always want to check what kind of gloves you have, and if the gloves that you carry are latex, request that they get the non-latex gloves. Now, talking about sterile gloves are kind of like shoes and other things, or as a general rule, a size 6 glove is a small, a size 7 is a medium, and a size 8 is a large. The glove should be close fitting so that there can be good dexterity, but not so tight that they compromise the circulation. Gloves are a one-time use only, so if you take your gloves off, you would have to put on new gloves the next time. In completing an aseptic hand washing, there is a designated sink, so nothing else should be dumped in this sink. No medications, no cleaning out your lunch pail, that kind of thing. The sink should have a deep basin so that it helps minimize splashing and can help reduce possible contamination. As you can see in this picture, these sinks have foot pedals, as we do in our lab. Sometimes they will have an electronic eye where you put your hand under and it activates the water. It may also be a knee paddle sink. Occasionally you'll have a sink that has the handles on it that you need to control with your hands. It's important once you complete your hand washing to not touch the handles. I'll talk more about that in just a moment. The designated sink is located in the anteroom or just outside the door of the clean room. And it's going to have a gooseneck faucet, which is a higher arch on the faucet so you can reach under to rinse your hands off. Foot pedals, as I described before, if not available and you have a hand control, after you've dried your hands, then you would take a lint-free paper towel that is dry and use that to turn off the faucet. The sink should be clean and free of any items that might cause splashing, like sponges or IV bags. As a sterile compounder, you'll perform a basic aseptic hand washing, and this can be done by vigorously washing both hands and the forearms for at least 30 seconds with an appropriate antimicrobial agent. That is the minimum. Best practice is to use a surgical scrub sponge brush that is pre-saturated with an approved antimicrobial soap. This is a pre-packaged sponge, and it will have a pick in it so that you can clean under your nails. The brush side would be used to clean around your fingernails and around your cuticle, and then it would be used on the sponge side to clean your fingers, the palms of your hands, the back of your hands, and your forearms. So, as a review, the anteroom preparation procedures include garbing, aseptic hand washing, gowning, and sterile gloving. Now, the removal of the PPE items is basically in the reverse order. So the last item that you put on was your gloves. The first item you take off would be your gloves, followed by your gown. The exception here, so USP 797 previously listed that you would put in the donning sequence the shoe cover, the hair cover, and then the mask. This has been revised. It is advisable to do the hair cover, the mask, and then the shoe cover. When you're removing your PPE, the shoe covers are the last to come off. So under the new one, it would be take off your gloves, your gown, your mask, your hair cover, then your shoe cover. Additionally, a quick review is to wash your hands. It should be to clean under your fingernails with a stick, the pick, then clean your nails using the brush, then clean all surfaces of your fingers using the sponge, clean the palm of your hand, then clean the other palm, then clean the backs of your hands, then clean your arms. Generally, you start with the left hand, complete the task, do the task on your right hand. Go back to your left hand and do the next task. When doing an aseptic hand washing, the minimum time of contact for the aseptic or the antimicrobial soap would be 30 seconds. Most hand washings will take between 2 and 4 minutes.